Good evening, everyone. Thank you for joining us. My name is Danita Johnson. I'll be your hostess this evening. Before we get started, we're going to have a couple of welcomes and introductions. The first person that you will hear this evening will be our chapter president, Ms. Brooke Holmes, and then following Ms. Brooke Holmes will be Dr. Sonia Bruton, our partner with CCI Health Services. Brooke, the floor is yours.
Welcome to our breast cancer awareness event. We are honored to have you here today as we support the fighters, admire the survivors, and honor the taken. I'd like to acknowledge the Physical and Mental Health Committee under the leadership of Carmen Frazier and Brenda Hoskins, as well as our Program Planning and Development Committee Chair and Second Vice President, Daphne Page Reeves, for all the work that they have done, the committee and the chairs and Daphne, in pulling all of this together so that we can, and in a short period of time, you don't know how much work went into getting this here for you today. And so I'm grateful for them and all the work that they do to help bring such great programming to the community. We cannot do this without our partners. Heartfelt thanks to our dedicated partners in CCI Health Services for your invaluable collaboration in this important cause. Together, we can make a difference. And I believe each of you are in for a treat, and we will definitely be hip by the time we finish this program today. So thank you so much.
Thank you. I'd like to say welcome on behalf of CCI Health Services. As you will soon find out in great detail, we are disproportionately impacted women of color. And so it's critical that we know what our resources are and that we take advantage of them. So thank you for having us.
My name is Latasha Barnwell-Area. I'm the Director of Population Health and Quality at CCI in partnership with Dr. Bruton and Carmen Frazier. First, I just want to say thank you for having me here today. And I just wanted to share a couple of things that CCI is doing related to breast health and breast health awareness. I think it's really important that not only are we outreaching the community and doing all that we can to make individuals aware of how to be advocates for themselves, but we're doing a lot of work internally as well. I represent the quality department, and we are running quality improvement projects to support our clinicians in clinical teams and knowing how to get the results that they need and communicate to our patients what those results are. I want to share one story that we have where, unfortunately, a young woman was diagnosed with breast cancer, and it was with quick work and oversight from our clinical teams where we were able to get that patient in that day that we got the results, share the information, and connect them to programs so that individual didn't have to worry about how she was going to pay for her services. We also partner with some of our insurance companies to host breast health screening events. For example, on Friday, we actually partnered with United Healthcare, and I'm proud to say that we brought a mobile van out in front of our parking lot, invited women from United Healthcare and uninsured patient population. And I'm excited to say we were able to successfully screen 18 individuals, with the majority of them being uninsured. We have amazing staff, which you get to hear from later on this evening, that connect the community members to resources in the community so that they don't have to worry about how they're going to get their care coverage. And if I can leave you with one thought, I think what I always, tell my team is that everyone could be advocates for their own health. And my team is responsible of being advocates for the community. And so early detection is key. All you have to do is just ask your loved ones, ask your mom, grandmother, aunt, sister, relatives, whomever, when's the last time you had your mammogram, right? And we don't have to be a medical professional to be an advocate for your own health and an advocate for your family. And so with that, I will turn it back to Danita, and I hope you all have a great conference. Thank you.
Thank you so much, Latasha. We really do appreciate the collaboration that we have with your entity and the wealth of information that you all share with us and allow us to help share in our communities. This is something near to my heart. I've been involved in breast cancer awareness for many years. So again, I'm excited for this event. I'm glad we were able to pull this off, as you said, Brooke, in a short time. I'm really going to save some space now for our guest speakers, the survivors. Berger, okay.
Margie.
Mr.
Yeah.
Harvey Berger, we're so glad to have you here, sir. And again, we're so honored that you're willing to share your story with us. It means a lot because honestly, when people think of breast cancer, they automatically think of women. So again, sir, we're grateful that you're here and willing to share your story. So I'm going to go on mute so you can share your story with us.
Okay, I'm happy to do it. And I'm well aware that I'm a unique person, or there are about 1% of cases are men. And I really had never thought about it, except in early 2021, we moved and I got a new primary care physician. And I had been having some inflammation and pain in my right nipple. And I at first didn't really think much about it. I thought, maybe I scratched it or whatever. But when I went to the doctor for my first physical, he said, you got to get that looked at now. And he referred me immediately to a breast cancer specialist in the MedStar facility that we were using. And she pretty quickly said, you better have this, we got to deal with this. So they tried to do an ultrasound, or they did an ultrasound. They tried to do a mammogram on me, which was an interesting experience for both me and the radiologist who was trying to do it. But those showed nothing. But so the doctor said, well, but there's a couple possibilities. So what we need to do, that we did a nipple excision. So that was arranged. That would happen when it came back. She called me. I went into the office. She didn't tell me anything. I didn't have my wife come with me. And pretty much the first thing she said was, you have cancer. There are 2 cells that showed up in the excision. And we need to deal with it. I said, can you get my wife on the phone? We did, so that she was brought up to speed very quickly. And we started moving forward. I was shocked, but I tend to be a pretty strong person. I can deal with things. And I said, let's just go and go on with it. And she said, well, the next thing we need to do is to find out whether it's spread. And the only way we can tell if it's spread is to do a mastectomy. And I said, okay. And we got that all set up. I had a port put in. Well, I guess not then, but we did the mastectomy, and thank goodness, when that was back, it showed it had not spread. So the only 2 cancer cells were in that sample that they had when they did the nipple excision, which was a great relief. So I started dealing with the oncology department. And they said, because it hasn't spread, all I needed was chemotherapy. Now, I did not need radiation. So we started chemotherapy. I was on 2 medications, a cancer medication and another special medication that was designed for people who test positive for HER-2. It's a genetic condition and a protein that causes cancer cells to grow faster if you have that. I didn't have any other genetic issues, so I didn't get the cancer because of my genes. But we started off on 2 medications, one for three months or so. I was going once a week for the cancer medication and the HER2 medication. The doctor had said, well, we're going to give you a light dose, so we'll see about side effects. Well, it wasn't a light dose, and I had all the side effects. I had lost all my hair. For 3 months, I didn't have to shave, which was nice. I didn't have to worry about haircuts, which was nice. But there were other problems too. There were some gastrointestinal problems and other things. So we lowered the dose some. And the rest of the time that I was getting both medications went fine. And then I switched to just the HER2 medication for about another 9 months, coming every 3 weeks. The good thing for me, I was able to drive. It didn't leave me, I could get up from the session and go get in my car and go home. So transportation wasn't a problem. And it took till on September 23rd of 2022, I finished my last chemo treatment, got to ring the bell, got a signed certificate from the people in the chemo department, and I'm now on a medication called tamoxifen, which a lot of survivors, maybe I've talked to a number of our women friends, and they've had to take tamoxifen. And luckily, I have Medicare and I have Blue Cross, and I had no financial problem with this either. And my mental state was good. I just said, I've got to deal with this. That I have a life. I'm a CPA. I went through a tax season getting chemotherapy. And that's it. So I think for me, the message to take out, those of you who have men in your life, if they ever have an inflamed nipple, that is the primary symptom for men. And if that happens, don't delay.
Thank you so much for sharing your story, sir. And thank you for sharing that tip as well. Generally, as we said, women, we hear the information is targeted towards us. So thank you. And thank you for telling us what we need to do for the ones in our lives. We appreciate you. Next, we have Ms. Pena. Dorothy, are you ready to share your story with us?
Hi, my name is Dorothy Pena. Thank you so much for having me here. I was the type that always went for my checkup. And back in August 2021, I had my mammogram. My mammogram was fine. And then January of 2022, I found the lump on my breast. I thought it was odd. It was very protruding at the top of my breast. And so I went to my primary doctor. And so she set me up to go ahead and have it checked out. So I went ahead and had a mammogram, MRI, PET scan, and they did a biopsy, and they found out that it was breast cancer, triple negative. Is it triple negative? Yeah. Triple negative. Yeah, it was triple negative. And I was stage 2B. And as soon as they got the results, the whole medical team came together, and I started chemotherapy. And then after my chemotherapy, I had surgery. I had a double mastectomy, and then they reconstruct my breast, and then I went through radiation, and I had immunotherapy, immunoinfusion, and then I was on chemo pill, and I am done. The transportation, my daughter was so wonderful. She commuted me back and forth when I was going through chemo, and I wouldn't have been able to do it without her. It was a lot on her. I was still working. I am self-employed. I'm a realtor. So she would just pretty much go with me. If I had settlement, she would be there for me. But the side effects was not very, it was, I had some good days and I had bad days, but I had a very supportive family and friends. And if my daughter couldn't do it, then I had a couple friends that would help me out. And now I was able, by the end of August of this year, I was able to ring the bell, because I didn't want to ring the bell right away. I wanted to make sure I completed the whole medicine. Everything I was going through, and I still worked out. I still walked, and it made me feel really good. It's just having a positive attitude. So. And the medical team was wonderful. If I didn't feel good, I could call them. Email them. Boom, they would call right away to make sure I was okay. So thank you so much for having me here.
No, ma'am. Thank you so much for sharing your very personal story with us. We really, really appreciate it. And our takeaway from your story is the importance of having a support system. Thank you.
Thank you.
All right. Next, our next special guest will be Ms. Kim Singleton Slater. Ms. Slater, are you ready?
Yes, I am. Good evening, everyone. Certainly want to give thanks to DST for having us on and for listening to my journeys and my co-survivors here. Really do appreciate how you guys are reaching out to the community. My journey was one of slightly a different experience. In 2007, I had 2 lumps removed from my left breast. They were benign. And so from that point forward, I always did self-breast exams. It was in 2009 is when I got up one Saturday morning, like I always do, because I do home interior decorating on the side. I went to paint my our dining room. I got up on a ladder and I said, oh, I forgot to do my breast exam. When I got up there at the top of the ladder, I felt this lump. Now, I'd already been feeling this same lump before, but this time it felt much more enlarged. And when I felt it, did my video just drop out?
No, you're good. They spotlighted you. You're good.
Oh, okay.
They wanted you to be the feature.
Oh, and then when I got to the top of the ladder, I felt the lump, and I said, it's different this time. It seems larger. Well, in the previous sessions when I went to have my breast exam, they always said, Kim, you're fine. You're just one of those that will have cysts on your breast probably all the time. But if anything ever changes, then give us a call. Well, that morning I felt the change. I gave them a call. I gave Kaiser Permanente a call right away. And I said, it feels like the size of a nickel. They said, okay, just wait. We'll have the doctor call you back later today. I know I was hallucinating, but I got to tell you, from the time I waited from that call to hear from the doctor, I said, oh, now it feels like a quarter. Well, in my mind, because I experienced a panic, this thing went from a nickel to a quarter. And they said, okay, well, Kim, it's all right. We want to see you first thing Monday morning. And I'm going, Monday morning? The panic sat in. And I said, I could really be dead by Monday morning. And they was like, no, you'll be fine. Remember we removed the last 2 that were removed. They were benign. Well, I waited on Monday. I went and definitely had the exam done. I was literally at work 2 days later when the doctor's office called. And he said, hey, need to see you. I close the business today. So I left my office and I drove over. And he said, did you arrive here alone? And I said, yep, I sure did. And because I was so convinced that it was benign, I went, what's up? I always drive myself, Doc. And he said, is your husband close by? And I said, he is, but he's actually in the classroom. My husband is a teacher. I said, but he's busy right now. I said, it's fine. And he said, I want you to sit down. Now, in my mind, I'm still thinking benign. And he's just kind of taking me through this journey to tell me, okay, we removed the lump. Here's what happened. By the time I sat down, he said, Kim, this lump is different this time. You have breast cancer. Now, I'm still thinking that he's playing. So I'm laughing, going, no, you got to be kidding me. I know you're just kidding. And he said, we're not kidding this time. And that from 2007 to 2009, when somewhere along the line, I developed breast cancer, but it was now at a stage 3. And he said, you want to get someone to come and drive you home because you're not going to be in a condition to drive. Just from the information alone, that could cause more trauma to you than you trying to get home alone. Well, I did. I made the call after I finished crying. I did make the call, and then within a couple of weeks, Kaiser Permanente had me into surgery. They were very good. They must have called and checked on me every 2 days up until surgery, and then every week after that. So they did an excellent job. I had lumpectomy. It was removed. I had to have 4 doses of chemo every 3 weeks, 4 different types of medicine pumped into me to kill me in order to keep me alive. But every 3rd week, I was there. Someone drove me. Someone picked me up. We had a huge network of church family friends, church family members and friends who stepped in to help get me back and forth to chemotherapy. From Thursday evening to Monday morning, I did nothing but drank water. I could not intake a lot of food. All I could do was drink water that I gagged on most of the time. But the water was the most important thing, because they said these are chemicals that'll kill everything in you, your good cells and your bad cells. But you got to drink the water to move the chemicals around your body. And then you got to turn around and pump them out. It was not a very good experience, but I got to tell you, God was always by my side. Every Thursday before my treatments, my brother, I'm from a family of preachers. There's 7 of us, and there's 9 of us, but 7 of them are preachers. And one of my brothers and his friend would call like clockwork on Thursday mornings before I would go to chemo. And we would do nothing but just laugh and talk. They took my mind off the fact that I had to go and have a treatment. They took my mind off the fact that you're facing death. They took my mind off the fact that this is a process that I didn't like, because by the time my body was getting adjusted, it was time to go back and get the next dosage. But my mom called all the time. I heard from my siblings. I even heard from my girlfriend, who's part of your chapter, Darlene Goodman Mims. I heard from a huge network of people. I also had, after my chemo, I had to have 6 weeks of radiation. That was a process that was necessary. So from start to finish, I really learned that God is a healer and God is a protector. It was a necessary process that I had to go through, because if I didn't, then how would I help with encouraging someone else to get through? That's mainly what I went through. Other than the 5 years after it, I had to return to the doctors every 3 months, once a quarter. And then it kept reducing itself until it got me back on an annual cycle. And even today, I always remind people, you need to do your breast checks. You need to do the breast exam yourself, and then you need to go and have a mammogram. Even though my mammogram had just happened the month before when I felt the lump in my breast. So it was actually there, it was showing up, but it was hiding the cells. When they multiply, they were hiding behind the lump. So it was on the back side of it. But even after the surgery, they test my sentinel node, which that's the one that carries the fluids to the rest of your body. So I was grateful that it did not carry anything to the rest of my body, because then they would have had to treat the whole self. That's my story. I'm still here 14 years later to tell about it, to talk about it. I'm grateful every morning that God allows me to get up and breathe. And I am just so grateful, because there are several people since my journey I've been able to walk alongside. Now, their stories, all of our stories are going to be different no matter what. But I'm just so grateful that the process and the advancement in medicine for breast cancer has changed so dramatically that not many get to face the process that I had to go through. Thank you again, DST. I love
Thank
you.
you.
There's nothing you can do about it.
We love you too, and thank you so much for sharing your story. And you almost lead us into a segue, but we have another survivor we want to hear from. But yes, we are excited about the advances in technology as well. Our takeaway from your story is, most importantly, be your best and your own advocate. You knew your body. Know your body is what we take away from your story. Know your body. Speak up. Do follow up with your doctors, and humor. We took away humor really is good medicine. Thank you again, Ms. Slater, for sharing your story.
Yeah.
Next, we have Ms. Vanessa Strauss. Vanessa, are you ready to share your story with us?
I am, and I too am grateful to be here today with all of you. My background's a little bit different than some of the stories that I've heard already. I was an exercise advocate. I taught Zumba, I taught aerobics, I taught different things, and I was very healthy and thought I was very healthy. During the time that I had been teaching for years, I've been at Delta for 47 years, and I'm so grateful for that, and grateful for all the things that my sorority sisters did to help me through this process. So I was having my normal breast exam, and I had what they call very dense breast. And Black women, a lot of us have very dense breast. And so they not only did the mammogram, they did the CD, the 3D, the 3D mammogram. And I would advocate for you, if you have dense breasts, to definitely get a 3D mammogram if your provider does that, and then do the whole breast screening ultrasound, because my primary doctor was the one who kind of said, something's not right. We need to do something with you. And so I also have Kaiser Permanente, and she was very, very, very definitely no today, that afternoon. And so I too went by myself and thinking, it's probably nothing. I have dense breasts. They've told me that for years. It's nothing. And when we did the testing, I went home and I didn't say anything to my husband. And so he just kind of said, you don't look like you feel well. I said, I'm just a little tired. The next day they called me and they said, bring someone with you. And my husband went with me, and we actually sat there. And when they said, you have breast cancer, I said, are you sure? And the doctor said yes. And for me, I was at stage 1A, which even though it sounds 1A, and it can go further than that, 40% of women who are diagnosed at stage 1A do not make it. So the bad thing I did was start looking up things on the internet and saying, what can I do? What should I do? And I have a big family too, but a couple of years before that, we'd lost my parents, my dad to lung cancer and my mom to multiple myeloma. So I knew how hard it was. I'm very close to my sister. We're 5 years apart, but I'm very close. So the first treatment, I didn't say anything. And then then she came over and she said, you don't look good. What's going on? So telling people is important, because my sister was right there. I had to tell my special from when I was in college that I pledged her, and she had breast cancer, and she was diagnosed 2 years before me. So telling people and having them help you through it is so critical, because you need the support. I was still trying to not tell my boss and going to work. I worked for HR for the Federal Deposit Insurance Corporation, which is that little sign in the bank where you insure all your money. So I as a manager, I wanted to make sure I was still strong, still able to go to work, and I worked in Arlington, and I still do. But I was on the way into work one day after having chemo, and I'm in the car and I'm driving. And for the first couple of chemos, I got a little sick afterwards. But I thought, okay, I'm okay. I got all the way to about 2 blocks from our building and just threw up all over myself. And I pulled over and I cried and I cried some more. Then I turned around and I came home. And my husband was just leaving for work. And he looked at me and he said, "What's the matter?" And I said, "Oh, it's all over me. It's all over me." And he said, "Go upstairs, change your clothes. You're not going to work today. Just relax, lay down. I have the car. I have everything." Just the support from him and doing that. And then I went back to start reading things that other people told me about. My doctor told me where to read. Be proactive. Learn what you have. Know what you have. I had a lumpectomy, and at the time there was a lot of, well, you have a lumpectomy. And after the lumpectomy, my left breast was the lumpectomy. I felt like I was uneven, and insurance companies sometimes don't want to cover if you have to have some surgery on your breast that is not affected by the breast cancer. So you have to be proactive. So I went back to Kaiser and I started talking to the doctors. My doctor was very, very proactive in helping me and helping me get surgery so that my breasts didn't look totally different from each other. And that was important to me. When I was first diagnosed, having the chemo, I thought was the worst thing. But radiation, I just felt like I was on a hot plate and they were frying me up for dinner. I mean, it was, I hated radiation more than I hated chemo. But going through it, this is 2006. I'm here in 2023. I wake up every day. God has blessed me every day. I'm so grateful for all the things that I'm allowed to share with other people and to say, tell your family, tell everybody you can, because you will get such support and such help. People care. They want to be with you. My coworkers would come in and sing to me in the office, and we just pray together, sing together. It's so important just to get that support and that help from anyone you can. And there are so many great organizations out here, and there's some organizations specific. I know, there's some organizations specific to Black women, which our mortality rate is 2 times that. Or 3 times that, I don't know specifically, of other races. And that's because sometimes we don't take care of ourselves. And so take care of yourself, be tested, get your breast exams, make sure you don't skip them. You can feel great one day, and then the next day, my world just fell apart, but God put it back together, and I'm here today. So I just want to thank you for allowing me to give my testimony. And I want to appreciate you, Danita, because we are friends from church, and we have been friends, and she is another one of my wonderful supporters. So I appreciate you.
Thank you, Vanessa. I was going to say she's being modest because she is still very healthy. I keep telling her I'm going to take one of her line dancing classes. But thank you for sharing your story with us. Our takeaway from your story is you have to tell your loved ones. You have to tell the people who care about you so they can love on you and help you through this and care for you. So thank you for that. Can we please, I know we're on Zoom, but can we use the reaction button to give a hand of applause for all our survivors sharing their stories? We know they were very personal. We know that you've all gone through something and it was hard. You came through, and your strength shines through. I'm trying not to tear up. Your strength shines through. And the fact that you were so willing to share what you went through so that others don't have to go through what you went through means so much. You're going to hear from Dr. Imimi, and I know I'm going to mess it up. I had it right the first time when we did the run of show. Imimi Owinga. She is the family medicine physician at CCI Health Services. Following her, there will be a presentation on risk factors and prevention from Miss Lacey. I'm not even going to attempt the first name. And then following her will be breast cancer stages and treatment from Dr. Sengupta. So, starting with Dr. Owinga, the floor is yours.
All right, thank you. Okay, so next slide, please. Next slide. Okay, so what is breast cancer? Breast cancer is, cancer of the breast, and it's determined, this is a female model. The breast cancer is determined by the type of cells which turns cancer. So if you look at the lobules in the lobe, you have those cells there, and then you have the ducts. So the main two common cancers in women are lobular and ductal carcinoma, invasive, next slide, the invasive ductal and invasive lobular. That's because of the location, if that's the location where the breast cancer is. So if you look at the picture, we have the A, you have the ducts there, and in the lobes, which is like the area B. On top is fat, which is why we usually say that our African American women, we have dense breasts. It's just that we have a lot of the lobules and the fat tissue that's kind of plump that's there. So in the lower one that's below it, you'll see what a normal cell looks like, which is the area of A. And in the area that's B, you see a ductal cell cancer that is breaking through the base of the normal cells. Can you guys see that?
Yes, ma'am, and I'm going to try to keep my question to the end.
Okay. All right. Next slide. So there is, as we mentioned, as we heard today, there's breast cancer in men. And in men, the most common breast cancer is invasive ductal and ductal carcinoma in situ. And this is mainly because of the differential in the anatomy of between men and women. So they don't have the lobules that we have. And it's very important, the same things that we see where, you'll have a lump, like Mr. Berger mentioned, the women may have the same thing as what a male is going to present with. And it's very important now, especially in this day and age, where we have transgender women and transgender men, to note that if you're a transgender woman, so you were assigned male at birth, and you're taking hormones, this is going to increase your risk of getting breast cancer as well. And you too also need to have screening done, the same schedule as a woman, the same schedule as a person who's been assigned female as birth. And if you're transgender male and you've had a mastectomy where they've removed some of the tissue, you still also need to continue getting your screenings done as well. Next slide, please. So the symptoms that you'll see in breast cancer, and these are the things that we need to be aware of. And sometimes just human nature, but women, no offense, Mr. Berger, but we're so busy multitasking and doing things that we notice something and it's like, that's nothing. Because we're, always, just so much is going on and trying to multitask, but any lump in the breast that is different from any other tissue or that's new. I usually say that the breast tissue feels like lumpy mashed potatoes or like oatmeal, where it's just different texture, but each person knows what their breast feels like. And if something just feels different, that's something that needs to be investigated. A change in shape or appearance of the breast. Our breasts aren't exactly symmetrical, but you know what your breast looks like. And if it starts to look a little bit different than what it normally looks like, you need to be aware of that. So normally they have women who have inverted nipples. And I'll always ask, is this nipple always been inverted? And they're like, yeah, it's been like that ever since I could remember, since I was a little girl. That's less concerning than someone who goes, no, it just turned like this, a few months ago, and they're not paying any mind to it. That is a reason that may be the first symptom you have of breast cancer. Changes in the texture over the skin of the breast. They call it peau d'orange, where the skin feels like that of an orange. How it feels. So it's not that smooth skin that that you usually have, but it kind of has that sense of that orange texture of what how an orange feels. I mentioned the inverted or pulling of a nipple, where it kind of feels like there's a strain on the nipple, like something is pulling on it from the inside. So it hasn't inverted yet, but it has like a tight rubber band type feeling from the inside. A breast rash that's just different. Like you don't usually have a rash in your breast and you start having one. Breast pain, it may or may not be associated with your menstrual cycle, but it never hurts to come in. And nipple discharge. If you're not lactating, you should not have any discharge coming from your breast, whether that's milk, blood, pus, or anything like that. Any one of those things may be the first symptom that you have of breast cancer. And that is for both assigned female or male at birth. Go ahead, Stash.
You want me to jump in?
Yeah, go ahead.
Okay. Hi, everybody. My name's Astasia Lacey. I go by Stash. To my coworkers, family, and friends, I am a board-certified family nurse practitioner. My role at CCI is the maternal and child health director, where I spend most of my time focusing on obstetrics and gynecology. So thank you, Dr. Owinga, for discussing some of the signs and symptoms of breast cancer. And I just wanted to thank those that jumped on and shared their story. I think it's so important to share those things and to help people to just be more aware of themselves. So we're going to be talking about that right now. We're going to talk about the causes of breast cancer. And so family history can play a role. I think you heard Mr. Berger, I think it was, talk about the BRCA or the BRCA gene. And so family history and genes do play a significant role. I encourage those, if you have access to it and you do have a family history, to get genetic screening. There are places, even your GYN office possibly, that can do those screenings to test you for that gene. And knowing that will allow you to know if you need to have more screening than the average person. Hormonal changes can cause breast cancer, which I'll touch on a little bit in relation to the breastfeeding in a later slide. Age, you do have a slightly more increased risk after the age of 40, but as we saw in the Kahoot, we do have a lot of individuals under the age of 40 that can develop breast cancer. So self-breast awareness, which we'll talk about also, is going to be really important. A personal history of breast cancer increases your risk, and some lifestyle issues. So, not having a healthy diet, inactivity, excessive alcohol consumption. And then sometimes you have environmental factors, which includes the exposure to radiation. We talked about lifestyle. So maintaining a healthy weight is extremely important in this case. It's not the end all be all, but when you are at your healthiest weight, you can lower your risk of breast cancer. When you started your period also plays a factor. So having periods at a younger age or going into menopause at an older age. And so younger age being 10, 9 or under, menopause at an older age, that would be someone who is going into menopause at mid 50s, 60s, would constitute as older age. Pregnancy, becoming pregnant at an older age or never becoming pregnant, which again, we'll touch on some of the relation to the hormones and why it is or being pregnant or getting pregnant at a lower age can decrease your risk of breast cancer. There has been some studies also, hormone usage, so long-term use of oral contraception or postmenopausal hormonal therapy. So a lot of times if you even I will say with the oral contraception, it is a very small risk. It is usually related to a very, very long usage of oral contraceptions, but I do want to give just a disclaimer: oral contraception is very safe, but there has been shown to be a very small increased risk with that. In regards to the most postmenopausal hormone therapy, when individuals, and I'll say for myself in practice, when I'm thinking about putting a patient on HRTs, this is one of the primary things that we consider before we put a patient on an HRT, is looking at what the benefits, will the benefits outweigh the risk? And obviously one of those risks is breast cancer. So make sure you are talking to your provider if you are someone who is in that postmenopausal, phase, talking to them about your risk before starting HRTs. There are a lot of alternative therapies that are non-hormonal to manage postmenopausal symptoms. So make sure you talk to your provider about that. All right, so we're going to jump into prevention. So if there's any concerns about developing breast cancer, you may be thinking, well, what can I do to decrease my risk? Of course, certain risk factors like family history and genes can't be changed, but there are some lifestyle changes that do help to lower your risk. I won't say these things prevent it, but it can lower your risk. So limiting your alcohol intake, maintaining a healthy weight. And so speaking with your provider about what a healthy weight means for you, everybody is different and individualized. Being physically active is important, and breastfeeding. So I just want to take some time to talk about the breastfeeding and the reason why, because I think sometimes people hear that and not really understand why that is. And so when you're breastfeeding, it decreases the amount of exposure to estrogen in your body. So the longer you breastfeed, it's been shown if you breastfeed for longer than 12 months on multiple occasions, your risk goes down by 4.3% every 12 months that you breastfeed. And that's in addition to 7.0% decrease in the risk overall with each birth. So every birth that you have, every year that you breastfeed, you're looking at 11.3 plus decrease reduction in your risk for breast cancer. So yay for breastfeeding and yay for having babies. Limit postmenopausal hormone therapy, which I touched on. And so it's in somewhat correlation with the breastfeeding. So it's the exposure, the length of time you're exposed to the estrogen hormone. If you're able to decrease that amount of time, it's been shown to reduce your risk of breast cancer. So breast self-exam, we're going to talk a little bit about, but I wanted to spend, for this slide, more of my focus on breast self-awareness. So clinically, we've kind of gone away from strictly advising breast self-exams. You may have heard that when you've gone into your doctor's office, maybe you haven't. And so my approach, I'll tell you my approach, every provider is a little bit different when my patients come in. We do a clinical breast exam, which is an examination that we do as a provider to the patient. I'll ask my patient, do you do a self-breast exam? Some people will say, yeah, I look, or some will say, no, not really. And, I don't really harp on them or significantly encourage, I educate. But we more so talk about breast self-awareness. And so what that is not only knowing your risk. So like we talked about, what's your family history? What's your personal risk of breast cancer? Talking to your provider about when you should get screened. And so what's the age that you need to start getting screened? Recommendations have changed with different organizations. For myself, and I think for CCI in general, we start at 40, and we recommend annually for someone who's at average risk. And then for your clinical breast exam, they say at least every 3 years, starting at 20, and then every year starting at 40. I will tell you as a general rule for myself, if you come and see me, if you're 21 and older, I recommend that you come back every year. to do a clinical breast exam. So knowing what's normal for you, what I want you guys to know and do is get familiar with your own breasts. Everybody's breasts are different sizes, different colors, different feels. It's really important for you to understand and know how your breasts are and what's normal for your breasts. And as you learn what your normal breast tissue is and the appearance of your breasts, if you are going to do a breast self-exam, you want to try to do it once a month. Ideally a week after your period, because during your period, your breasts do change because of the hormonal changes. Try to look in the mirror if you can. And I always tell patients too, if you have a partner, have them look at your breasts, get familiar with your breasts. And there's actually a huge study out there that a lot of times partners actually recognize the differences in the breasts and are able to detect signs of breast cancer. So you want to touch all the portions of your breasts. I usually tell patients to kind of go clockwise using their finger pads. You can go up, down, across. You're feeling for any lumps or bumps, masses that weren't there before, any pain, tenderness. You want to check under the breasts and around the chest wall and sternum, and really focusing also in the area where your armpit is, as that's where your lymph nodes are. That's just a quick exam. You can do it in the shower. You can do it at home, of course, at home. I hope you're doing it at home. In the shower.
I am loving the live model. Thank you so much, Dr. Owinga. You were like, I'm going to show y'all how to do this.
Oh, yes, Doctor. And yes, you saw Dr. Owinga. She, at the end, is squeezing the nipple. And so that's so good to do because, like Dr. Owinga said, you shouldn't have anything coming out of your breast unless you are breastfeeding. So if you see any discharge, white, yellow, green, bloody, it's important to let us know. I am the type of provider, if you feel pain, come and see me. The worst thing we can say is, oh, this is normal, or hey, we need to get some more testing to see what's going on. So if you ever feel like there's something new, different, or you're just not sure, come in and see your primary provider or your gynecologist for an exam. And I'm going to stop sharing my screen. Thank you.
Thank you so much. Thank you, ladies. Next, Dr. Sengupta.
Hi, everyone. Thank you so much for having me to talk. My name is Dr. Sarupa Sengupta. I'm a breast surgical oncologist, and I'm going to be talking to you guys today about the stages and treatment of breast cancer. So give me one quick sec to share my screen here. All right, can you guys see what I'm seeing here?
Yes, ma'am.
Great. All right. So I am going to move forward here. The first slide has actually already been covered, but how does cancer form? We've already discussed this a little bit. The breast is composed of lobes or lobules and milk ducts. The milk ducts are where we are interested because that's where the cells that can form cancer proliferate. Cells that proliferate inside the milk duct and remain inside the milk duct are called ductal carcinoma in situ. And then when those cells become really active and break free from the duct, those are called invasive ductal carcinomas. So what does a stage mean, right? Everyone talks about the stage of breast cancer, but what does that word mean? The stage of a cancer tells you how well you're going to do with this diagnosis. And in general, stage has an inverse relationship to prognosis. And what that means is the higher your stage, the poorer your prognosis. So stage 0 to 4 is where we put breast cancer. DCIS, which is that cancer that lives inside the milk duct, is stage 0, and it has the best prognosis. Invasive cancers go from stage 1 to stage 4. So between them, we kind of span the whole rainbow of how you can do from this breast cancer. It's important to note that when you are diagnosed with cancer, stages 0 to stage 3 are curable stages of cancer, whereas a stage 4 is no longer curable, but is manageable. Breast cancer, like all other cancers in the body, are staged with what's called TNM staging. and the T stands for tumor size. The N stands for the presence or absence of abnormal lymph nodes, and the M stands for the presence or absence of suspected or known metastatic disease. This is kind of a schematic of where the breast cancer staging lies, stage 0 to stage 4. So stage 0, again, like we talked about, the abnormal cells are found inside the duct, but they haven't left the duct. Stage 1, this cancer has left the duct itself, invaded some of the fat, but hasn't gone beyond that. Stage 2, the cancer got kind of big, almost 5 centimeters, or there's lymph nodes that are involved. Stage 3, we have bigger tumors, we have lymph nodes, and occasionally we'll have skin and muscle involvement. Stage 4 breast cancer means metastatic cancer, which is different than invasive cancer. Metastatic cancer is cancer that spreads beyond the breast and axilla and lands somewhere else in the body, like in the bone, in the lung, in the liver. And as I mentioned before, stage 0 to 3 are curable, and stage 4 is no longer curable, but with modern technology and medicine, we can actually manage this for a very long time, very effectively. There were new guidelines put in place as of 2018 that actually added on to the TNM staging. And some of our survivors actually may be aware of this. One of the things that we learned about with all of this research that's been done about breast cancer is that the biological behavior of your cancer actually impacts your prognosis. So what do we mean by biologic behavior? One of the things that you hear about when you hear about breast cancer is, are the cancers hormone receptor positive or hormone receptor negative? And we heard from one of our survivors that he had a cancer that was HER2 positive. So these are the markers that we look for on the cancer cells to tell us how this tumor is behaving. We look specifically for estrogen receptors, which means the cancer is responsive to estrogen, progesterone receptors, which means the cancer is responsive to progesterone, and that molecule called HER2, which is a growth factor. And obviously, if anything has a growth factor associated with it, it does exactly what it sounds like it does, and it grows. So our next schematic here looks at the different types of cancers that we have, and all of these types are actually involved in how we stage the cancer. The cancers with the best prognosis are hormone receptor positive, HER2 negative, and currently that's changed a little bit to hormone receptor positive, HER2 positive, because we have targeted HER2 therapies. The cancers with the poorest prognosis are the hormone receptor negative HER2 positive cancers, or the triple negative cancers on their own. And you'll see a little note at the bottom of this circle that I want everyone to kind of pay attention to. There's a higher incidence of these really kind of aggressive cancers that occur in women of African American descent or Black women. We don't know exactly why. There's a lot of theories and a lot of research being done on this right now, to be determined, but we know that it happens. So for that reason, we want to make sure that kind of the points that were made before, early screening saves lives, and I'll get back to that in a minute. Once we have our cancer, the next thing we need to talk about is what we're going to do about the cancer. Now, as a surgeon, my realm of what I do rests in the surgical component. So breasts, there's 2 categories of treatment that we look at. Local treatment, which treats the cancer where it's growing, which is your breast, and then systemic treatment, which treats the body in which the cancer has developed, which is the rest of you, to make sure that the cancer does not come back again. Local treatment is comprised of surgery, obviously the tumor needs to be removed, and radiation, which is basically an insurance policy that even once the tumor has been removed, if there are a couple of cells around that area, we want to make sure that those cells never regrow into a new cancer. In terms of systemic treatment, we have hormone therapy, which is technically anti-hormone therapy, or endocrine therapy, which is anti-estrogen medication for those patients that have tumors that are responsive to estrogen. Chemotherapy, in which there has been a lot of advancement, both in the types of treatment and an elimination of chemotherapy for a number of patients who have really good prognosis cancers. Targeted therapy is the third and kind of newest portion of systemic therapy that is used. These are all the immunotherapies that we use for patients who have specific types of cancer. The very important thing to remember in 2023, these four modalities of treatment are used in different orders and permutations depending on the patient and depending on the cancer. And really the take-home point of that is every single patient is going to have a treatment plan that is different and specific to them. Historically, way back, kind of even before I became a doctor, every single person used to get chemotherapy for cancer, right? Everybody across the board used to get chemo, used to get radiation, used to have radical mastectomies in which they remove the breast and the nodes and the muscle. A lot of advancement has come to look to find out what can we eliminate and still be safe. In all of that learning, we have come to what's called targeted therapies. And we target our patients' treatments to not only their cancer in their body, but also to their wishes. It matters what you want. If we have options that we can provide to you in terms of surgery, in terms of mastectomy versus lumpectomy versus reconstruction, whatever we can offer, whatever options are available, we would like to provide. Your opinion matters. One of the most important things that has already been touched on multiple times here, guys, the earlier we catch it, the lower the stage, the easier to treat, the better the outcome. So please, under all circumstances, get your mammograms every year. And thank you so much to Dr. Owinga and Stash for saying 40 and yearly. There have been some confusion about guidelines recently, and all of us who do this for a living, whether it's OB or breast surgery and breast surgical oncology and oncology in itself, all of us advocate for 40 and yearly because too often we have seen, especially in my younger Black patients, these cancers pop up out of nowhere. And they pop up young and they pop up aggressive. And if you're not paying attention, they can get to a point where it becomes really difficult to treat minimally. So please, please get your mammograms every year. And thank you so much for having me. And just very quickly before I end, to the survivors, thank you so much for sharing your stories with us. It's, again, making me tear up too. Taking care of breast cancer patients, I know how difficult it is to come back for some of you this many years later and share that journey that was so scary and so traumatic and so life-altering at the beginning. So a heartfelt thanks to you for sharing with us. Thank you guys very much.
Thank you, Dr. Sengupta. Thank you, Dr. Owinga, and thank you, Stasia. Is that what you said? That's how they pronounce it? Thank you. Thank you all for that great information. I know we will have a question and answer period at the end, so please get your questions ready. I know I have a couple of questions myself, but you answered a lot of them with that information, so thank you. So we're almost near the end of our program, and we do hope and pray that this has been uplifting and inspiring as well as informative. You may be wondering, what's the next step? We have all this great information. We've heard the testimonies and the stories from the survivors, but what do we do with this information? Well, we have a way that you can get involved. And so what you will now hear from is 2 local organizations that support people in their breast cancer battle. First, we have Bronte Montgomery, who is the co-founder of the Donna M. Foundation. And after her, we will hear from Vicki Walton, who is the CEO of It's in the Genes. Ms. Montgomery, the floor is yours.
Thank you. Thank you for having me tonight to speak on behalf of the Donna M. Saunders Foundation. I appreciate you all listening to hear about the work that we do. To the survivors who spoke, thank you for your stories. It is definitely a journey, and we appreciate your ability to be able to be vulnerable and share your personal stories. As Ms. Johnson said, my name is Bronte Montgomery. I am a founding member of the Donna M. Saunders Foundation for Breast Cancer Education and Support. We established the foundation in 2012 after losing our dear friend Donna to breast cancer. Donna was diagnosed the first time when we were in undergrad. She went to Virginia State. I went to Virginia Commonwealth, and one of my childhood best friends was her roommate. And so that's how we met. Donna was diagnosed the first time when we were in college, left school, and went through her treatment. Her breast cancer came back years later and spread and metastasized. And in 2010, Donna decided that she was going to discontinue her treatment because she was tired. She was in hospice, and they told us to come visit her because they understood that her life expectancy was not much longer. And Donna, when she was in hospice, we went to visit her that day. It was interesting because we were very somber and solemn, and because at that point, you kind of don't know what to expect. And so we walked in the room, and she looked at us and she said, "Oh my goodness, I'm not dead yet. So put some smiles on your faces." And so that lightened the load for the rest of us to be able to really have that last conversation with her. And we said to Donna, how do you want us to keep your memory alive? And Donna said, I want you all to help people. She said that through her journey with breast cancer, there were many people who were alone. And she would go to treatment and see people alone. She would talk to individuals who were struggling financially, struggling to be able to pay their bills to have treatment, or to be able to even pay their living expenses. And she had family and friends who were able to support her in that manner. And so she said, I want you all to help others. So that's what we did. And so we established the foundation, became a nonprofit in 2012. And our mission is to provide educational awareness to the public about breast cancer for early detection and those things that the medical personnel have discussed with you. But the other piece of that is to provide financial support to breast cancer patients. We are a 100% volunteer organization. We're a board made of 10 women from various professional backgrounds. Currently, our board is all African-American women. And I'm sure you all would be pleased to hear, at least for the members of Delta Sigma Theta Sorority Incorporated, 7 of our board members are members of Delta Sigma Theta Sorority Incorporated. The other 3 of us are not member of any Greek organization, but they definitely have a strong presence and are very supportive as we go along in that journey. Next slide. So what do we do? I want to read something because this really is the crux of what the first bullet point, which is we provide financial support to breast cancer patients. On October the 11th, on last week, we received this email and an application from a young woman. I'm a second recurring breast cancer patient. I'm diagnosed with HER2 positive metastatic breast cancer, and I have 2 children that I care for with no family support and support from the co-parent. I am often a prideful woman that works multiple jobs to make ends meet, and I don't ask people for anything. I'm writing to you today after applying for assistance on your website because the face of cancer, receiving chemotherapy, which is harsh on the body, mind, and spirit, and having to call out of work a lot, I am in desperate need of emergency assistance for rent. I am paying little by little, as much as possible. However, of course, it's not nearly enough for the rental office, who has been kind enough to give me grace in the past, to accept, and they want full payment. I am doing the best I can to keep up with all of my bills, but of course, not having a home is superseding everything else. I am in need of surgery soon and want to get paid up on my rent so that in the event I need recovery, so far the doctors are saying 2 to 3 weeks before I can work, I won't have to stress about being evicted. There was a court date yesterday for possible eviction of my children and I'm terrified. I had chemo yesterday and was not even able to attend the rent court hearing, so I'll be following up today. I can provide documentation that you need. She goes on to say, I appreciate your organization blessing women like myself in tough situations while fighting this horrible disease. I had a double mastectomy in 2018, and I thought that I would never have to fight again. So although it's been a while since I've been going through treatment, there's not a day where my children and I are not devastated by this diagnosis given to me while still losing people to cancer and around us at the same time. then she says currently the amount of her rent, and she's behind for September and October. So that was on October the 11th. I sent out an emergency request to our board. And on October the 12th at about 10:30 at night, I was scurrying to the post office in my PJs, and I won't tell anybody that, to put in an express mailing to mail the rental payment that she needed for 2 months, a little over $2,500, to be able to ensure that she and her family could continue to have a place to live. So that's what we do. We provide awards of financial assistance, really to bridge that financial gap during treatment when individuals aren't working and don't have other alternatives for resources. Our average grant is $500. However, you noted in that circumstance, we gave more because there was an emergent need. We also do chemo kits that we send out. And so if an individual is newly diagnosed, you can send us an email letting us know that someone has been diagnosed. And we send out a chemo care kit with items that they'll need to be able to let them know that somebody is thinking about them and keeping them in mind through the journey. Other initiatives that we have include holiday special gift giving baskets. We'll do a spa day. Last year, we took a group of women out to the Salamander out in Middleburg for just a day of relaxation. We do just ad hoc awareness events in the community, such as this, speaking and supporting organizations. We do a bus trip to Broadway. We try to do one a year where we'll get a group of breast cancer patients and other individuals so we can do awareness and support at the same time. We have a Love on Top golf event, which is focused towards generally towards men, and then also those individuals who are caregivers, because many times there are many men who are spouses who are caregivers. And then we will host a virtual breast summit that started before COVID, but we felt that the opportunity to be able to connect with other national breast cancer organizations and share our story was important. Fundraisers, we have a fundraiser in October. Is our great fundraising month. We have a program called Pink Tie Guy, and we get guys to vie for the title of Pink Tie Guy, and individuals vote for them by making donations. And so we started on October the 1st. We had 18 gentlemen who stepped up to the plate to be able to fundraise. And as of today, we are, I think, probably at about $48,000 they have raised so far this month for us in fundraising efforts. And those funds go to support our mainly our financial support program, but the other initiatives that we have. We have a 5K race. We do movie nights. On December the 9th, we will have a premiere private showing of the movie The Color Purple at the Regal Theater in Springfield. So we buy out a theater, have folks come together, and so we'll do a movie night and do an awareness event. We have Behind the Pink Curtain, where we'll have speakers come on. We've had April Ryan, Will Downey, who come on and just talk about breast cancer, the impact in the community and in their lives. Or we'll have speakers who will just talk about something else, but it serves as a way for us to be able to connect. We do a Hatitude Tea each year. And then coming up on the 28th of this month, we have our Pink Tie Gala, which will be in Fairfax, Virginia, which is our gala. We'll be celebrating kind of delayed 10 years because COVID messed us up. But we'll be celebrating the great work that we've been doing over the last 12 years as an organization. And so, our goal really is to be able to provide that support, bridge the gap for individuals, and to ensure that individuals have the support that is needed. I think the next slide probably has our website. And so if you'd like to go to our website, breastcanceraid.org, to be able to either make a donation, take a look at the other events that we have coming up. If you know someone who is in need of assistance, currently we are providing assistance in the DC, Virginia, Maryland, and New Jersey markets. And so if you know someone who needs assistance, they can go on our website and they can apply for financial assistance. One of the things that we strive to do, and we find ourselves to be different than other organizations, is our expedient turnaround with regards to providing assistance. As I indicated, appreciated, the application that I just read to you was she submitted on October the 11th. By October the 12th in the evening, we had the checks in the mail to her. We pride ourselves on that because we understand that people don't need to have stress when they're trying to heal and trying to think about, is my rent going to be paid? Am I going to be evicted? How am I going to put food on the table? They don't need that. And so we cut a lot of the red tape in our application process. We do require that individuals do provide medical documentation or verification of treatment, but we don't require people to submit tax returns and bank statements and all that information because we understand that breast cancer doesn't discriminate, and you could have a decent job and be working, have health insurance, and just the impact of the breast cancer diagnosis can be devastating financially. So that's who we are. That's what we do. And we hope that we can continue to partner with organizations and get the support that we need to continue the work that we do. Thank you so much for having me on tonight. Definitely appreciate being able to share our story.
Thank you, Ms. Montgomery. That's awesome. Ms. Walton?
Hi, can you hear me now?
We sure can. Thank you.
Awesome. Thank you for having me. Blessings to everyone that has shared. I won't be long because we're at the end of it. I'm Vicki Russell Walton, and I'm the creator of It's in the Genes. And what is It's in the Genes? Well, it's an organization, an LLC, and a nonprofit where we assist women with promotional and educational materials. I know when I was misdiagnosed the first time, in 2007, I was misdiagnosed 3 times and given months to live. And what I found out was there was no hope for me in the community as far as support. If it wasn't for my family, I don't know what I would have done. And that's where It's in the Genes came up from, because you carry your genes with you. You carry your bloodline with you, your legacy with you. You wear your genes every day. So that's where that came up. And what we do is we have organizations and we have lots of events in the community. Our famous event is the Pinky Party. And what is a Pinky Party, you ask? A Pinky Party is a party where you come and receive your mammogram. But while you're there, you can get your nails done. You can get your hair done. We have childcare. We serve lunch. There's a DJ. We have raffles. There's community vendors. And we just don't do this for October. We do this every month. We're between Maryland to Atlanta to New York to Philadelphia, North Carolina. And again, it's every month and it's always at a hospital. So a woman and or a man can receive their mammogram while they're at the party. Our supporters are great in the community, but we work with America Health Caritas, MedStar, Howard, Community of Hope, Breast Care of Washington, Doctors Hospital. We work with all the hospitals, and now we're in Montgomery County. I'm now the new cancer prevention specialist for the African American Health Program, and we're extending all of these things over to Montgomery County as well. We also have something called the Seasoned Sisters Speak Talk blog, where I interview women and we share our stories, but we also educate about mental health. We don't talk about this in our community, especially when it comes to dealing with breast cancer. It can be definitely depressing and sad and scary if you don't know what your options are, what you're about to face. So we have relationships with those that can help you. But Seasoned Sisters Speak Talk blog is on the air, and we would love to have most of you as our guests. We also have the Man Cave, and that's Harvey's Huddle. It's my husband, and he talks to the husbands and the caregivers dealing with wives who don't know what to do. She's crying, she's laughing, she's crazy, she's not, what do I do? So the husbands have a huddle where they can share their experiences, and they can also bounce off of each other what the best plan is and what's going on. And they also have someone that they can depend on. I know you hear my voice going. And we send out booby boxes. A booby box is a box filled with goodies: socks, blankets, eye masks, massagers, crossword puzzles. We send everything but food. While you're sitting there waiting to have your test done, sometimes you're by yourself. So there's a teddy bear in there that will say the Lord's Prayer with you if that's what you believe in. But we send booby boxes out and they go all over the world. They've gone as far as Japan and South Africa, and we're very proud of that. That is reaching that far. We have the Ribbon of Love initiative, where the children in the school create cards for cancer patients, and we mail those out. And these cards are hilarious. I know one card said, you know, enjoy life, get up, roll over, and fart. That's what I do. I mean, they're the cutest cards because these kids are innocent and they don't understand the hardship, but they know mom is going through something or dad is going through something. So we get these beautiful cards from these children who just want you to be happy, and we send those out. We also have our Pink Couch Conversation and the Chat and Chew. And those are events we have twice a year where women come together under the pink tent. We share, we sip tea, we congratulate each other, we celebrate each other, we empower and inspire each other, and we just love on each other for 2.5 hours. Those are some of the things that we do in the community. We also work with a lot of great organizations. We love to collaborate. I'm a big supporter when it comes to us supporting each other because, as we all know, chronic diseases love African American women. Why, we don't know. I think it's all that melanin that we carry. I'm trying to figure that thing out. But there are a lot of organizations that can help you with your wigs, with your car, with your rentals assistance. That we don't pay funds, but we connect the dots to help you do that. And we have a lot of great supporters in the community again. So I'm Vicki Russell Walton. I am the creator of It's in the Genes LLC, It's in the Genes Inc. I'm also the creator of VR Walton Consultant. And we are in the community, not for me, I'm in the community for you. So as I always say, make sure when you wake up in the morning, you do something. Not promise tomorrow, but do something today. Thank you for having me. If you need me, reach out to me, 301-442-5105. I don't have my backup behind me with all my information on it, but Carmen knows how to get in contact with me. And again, it's not a party unless it's a pinky party. So every month we're somewhere, so bring us out. Have a great night, everyone.
Thank you, Ms. Watson. Another great organization. And Carmen, we'll make sure we get that information and share it. At this time, we want to open the floor for any questions that you may have. You can ask questions of the survivors, you can ask questions of the healthcare providers, or you can ask questions of the two support organizations that we just heard about. I need the info on them pinky parties. I'm just going to show up, get my nails done. I mean, you making go get a mammogram sound like fun, and we all know.
Yeah.
So that would be wonderful. I'll make sure I get that information. But again, we'll open the floor. If you want to put your questions in the chat, feel free to do so. If you want to use the raise hand function, and I see a hand is up. Miss Jean, is it Kanisha Lewis Jean?
You got it.
All right.
Thanks so much for this awesome program, Delta Sigma Theta, CCI. My name's Kanisha. I actually live in Boston. Plan to relocate or locate to DMV next year. So I wanted to start connecting with folks. So this is an awesome opportunity to do that. Every presenter, this has absolutely been amazing. As a patient and especially as a provider, I'm a nurse practitioner in a federally qualified health center now in one of our communities. And there are a number of patients coming to mind during the presentation, particularly patients that had mammograms recently within like a month or so and message me on my chart or maybe schedule telemedicine and say, hey, I don't know, I'm feeling this pain, or like, I don't know, I think I might need to come back and get checked again. And I have to tell them myself and say, I think I've relied on the radiologist too much and feeling like, oh, she just got a mammogram, it should just be fine, you know? So definitely being intentional about not brushing that off. Or another patient came to mind today that had cystic breasts. And she's like, well, I mean, can't they just take it out? You know, isn't that an issue? And still like being intentional about like talking about that and dense breast and such. So really made me think about, as a provider, just being intentional in my language, and also like not remembering that it's a person reading these, you know, and not putting too much emphasis on the mammograms, especially listening to women, everyone that is. One question I do have, because one one battle I have with getting some people to get mammograms or just early detection is I don't want to know.
Yeah.
That's, it's easier for me to battle the machine. I don't want my breast to be squeezed. The fear of like the machine I can sort of handle, but the I don't want to know, that's definitely a challenging one. So any advice anyone has for that is more than appreciated.
So
Can I get a comment?
Oh, I'm sorry, Ms. Walton. I see your hand, and then I was going to say we're actually going to defer to the medical professions. But go ahead, Ms. Walton.
Well, that's one of the reasons why we created this party. We heard everything of why I can't do it. From childcare, not a problem. We have childcare. I don't have transportation. That's why I work with the insurance companies. They'll come and pick you up, Uber, right at your front door. Put your teeth in, grab your wig, let's go. What else? You don't have lunch. Fine. Now we have a lunch supply sponsor. I don't have, someone to watch my husband. Bring your husband with you. We got a man corner. So there always will be barriers. But let me tell you where there aren't barriers. When they go to these concerts, there are no barriers. Okay? When you go get your nails done, there are no barriers. When you go get your hair braided, there are no barriers. So yes, it is a fear of once I find out I have breast cancer, who's going to watch my kids? How am I going to get there? How am I going to eat? How am I going to pay for it? You have to have those resources available and let them know, hey, look, you may have these issues, but guess what? This organization, that organization, this organization can help you. So while you're telling them that they need to get this done, also remind them they've got backup, okay? Let them know you can do a juice call and call the neighborhood in, because a lot of times you have to meet these people where they are. If they're already struggling, they don't want to hear from us. Who wants to hear from us that now you've got an added bill, that you've got added responsibilities? And a lot of them are single mothers. So you have to make sure you have backup resources already ready, a plan B already ready for them. That's just my take on it.
Well, Ms. Walton, you answered the question. Ms. Jean, what you need to do is get this organization's info and have it ready to give to those patients, okay? Ms. Eva Marie Ojo, I see your hand. Thank you, Ms. Jean, for your question.
Thank you.
Ms. Ojo, you want to come off mute? Okay. We'll move on. Maybe she was trying to applaud and not ask a question, or because I don't see anything in the chat. So we'll go on. Miss Booker Conde, did I say your last name correct?
You came off mute.
That is correct. Thank you.
Okay.
I
hear you. I hear you, Book. Go ahead. I'm sorry, Miss Conde.
Okay. I do apologize if this was answered already. I had to step away for a little bit. But earlier in the discussion, one of our speakers talked about advocating for 3D breast exams. I have substantial breast tissue and have never even been presented with that as an option. I didn't even know that it existed. But now that I am much, much older, almost 50, and the breast tissue is more fat than it is muscle density, is it as necessary at this age to still advocate for that technology?
I see you nodding your head, Dr. Sengupta. Go ahead.
Yeah, thanks. So that's a really good question. I'm so glad you asked. 3D mammography was a technology that like 7 years ago, most insurance companies weren't paying for. Now we know across the board for almost everybody, but especially women with dense breasts, it's just a better screening modality. Like it's just better. So if there is an opportunity for you to have a 3D mammogram, which at this point in time, pretty much every radiology center in the DMV, all the ones that we work with in Montgomery County, WRA, CRA, Rad Clinic, Hopkins, everybody offers 3D mammography. Okay, so definitely request from whoever your provider is, whether it's your gynecologist or your primary care or whoever, said this year I would like to have a 3D mammogram. Can you please order it that way?
Thank you.
Thank you. All right, Ms. Ojo, I apologize. Brooke said that Sora Holmes said you came off of mute. There you go. Go ahead. What's your question?
Okay, so this is really funny. This is not even Marie. This is Kalila Jones. She sent me the link because I was moving and I was trying not to be late. But I'm here. This has been awesome and amazing. I have a question in reference to the genetic testing. So I've heard about the genetic testing. I know some folks who had it and it was beneficial. I know some folks who haven't had it, and life goes on. Having a young daughter, young adult myself, how common is the gene to where, the concern of it? Like, how common is it that there's a possible, I don't know how to word it. How common is the gene that it would affect whether you get it or not? Because I know my oldest daughter, she's like, I'm not going to get it. It just, at this point, I'm going to get my mammograms, blah, blah, blah. But I think the genetic testing is going too far. What's the conversation? Can I have the conversation saying, hey, look, it's not a rare gene. If it's there, it's there. Or am I having the conversation, hey, this is common. Go get it checked out so you can see what level it is. Does that make any sense?
Again, I see Dr. Gupta nodding her head. So
yeah. So this is something that I deal with all the time. And I kind of want to take a step back and understand who gets genetic testing. So generally speaking, when I see patients in my office who come in for, request of genetic testing or something like that, what we're looking for is a strong family history. If you have even one first-degree relative that had breast cancer at any age, but specifically a young age, you automatically will meet criteria for genetic testing. Generally, what we do as providers is we'll run your family history, your personal risk factors through a screening modality. And that screening modality will spit out a risk for us. And it'll tell us what your lifetime risk of developing breast cancer is. If that lifetime risk is over 20%, not only do you meet criteria to have extra screening, right, in addition to your mammograms, like MRIs. I think, Astasha, you just left a little message in there about the MRI screening. Not only do you meet criteria for that, but if you have multiple family members with cancer, in that case, that's when you talk about genetic testing. If you're somebody that has no family history at all, okay, the risk that you're going to be the first person that has a genetic mutation is actually pretty low. Okay, so for an average risk woman, you do not need to get cancer genetic testing. But if there are a number of family members in your family with any type of cancer, to be honest, I mean, we're only talking about breast and ovarian here, but a lot of thyroids, a lot of colons, anything like that, it's worth having the conversation. But average risk does not need genetic testing. And I don't know if the other providers have any other opinions about
Sasha
that.
gave the thumbs up.
Okay,
Thank you. That's perfect. Thank you. Thank you for that answer.
Yeah, I hope that helped.
Oh, she said thank you. It did. Okay, I didn't see any questions in the chat. I'll double check. Carmen's nodding her head no. I don't see any other hands raised. Double checking. Okay. So I will relinquish my stand at this time. And again, I want to just thank everyone for being here. Thank you for taking time out of your busy schedules and hearing the great information that was presented, the survivor stories. Thank you for sharing the names of the loved ones, your ones who lost their battle to cancer. Just thank you for being here. And thank you for participating. Carmen.
Hi, everyone. Thank you again so much for joining us this evening. I just want to do a special shout out to the Physical and Mental Health subcommittee for this event. You guys did awesome putting this together, and it's been a joy, and thank you to all the speakers. I do want to pop up the survey and just remind everyone to please take the survey. This is actually our first virtual program for the sorority year, and we want to absolutely do more. And so that we definitely ask if you can please take a picture and scan the code and take the survey to kind of let us know what you like, what you didn't like. We want to continue to bring great programs to the community. And I'm going to let my co-chair say a few words. Shore Hoskins. Okay, well, and while she gets all that up.
Oh, there she goes, Carmen. She's just trying to come off mute. I just realized that I was on mute. On behalf of our great sisterhood, Delta Sigma Theta Sorority, the Physical, Mental, and Mental Health Committee, and the subcommittee, as Carmen just said, we just want to thank everyone for their willingness to be supportive of this event, the breast cancer survivors who shared their journey, the healthcare professionals for sharing new treatments, our support group, Donna M. Summers Foundation, and It's in the Genes. Very interesting. And finally, our great invited guest, if you're not even a part of Delta Sigma Thetas, but friend of ours, thank you for graciously accepting our invitation to participate in our awareness event this evening. I am hoping that something that was shared will help you or help you help someone else, someone to hold on to hope as they battle breast cancer. Sometimes our little acts of kindness and self-understanding makes all the difference. Thank you.
Great. Thank you, ladies. And again, thank you to everyone who joined us. We were so excited to have you. Again, it's been wonderful. Lots of great information, some things that I was not aware of. And I'm sure I've heard a lot of you say, didn't know that, this was interesting. So thank you. We're glad that you enjoyed the information and the event. Be sure to share. Be sure to fill out the survey. Look for future events from CCI and Delta Sigma Theta, or excuse me, Potomac Valley Alumni Chapter of Delta Sigma Theta Sorority Incorporated. This is a great collaboration. I believe this is like our third event, Carmen, third or fourth. Am I right?
Something like that. I lost track. It's been a lot.
Oh, also, she put a shameless plug in the chat. CCI is hiring. So if you're interested in working with this great organization, check them out. So again, we want to thank everyone for being here with us this evening. Have a good evening. God bless.
Great event, everyone. Thank you. Have a great evening.
Thank you. You too, Ms. Walton.
Awesome.